Hi everybody, welcome to my channel. Today we're going to talk about autism. I'm Rita and today it's all about you. Autism is a developmental disorder characterized by the difficulty of social interaction and communication and restricted and repetitive behaviors. Autism is associated with a combination of genetic and environmental factors. There are certain infections that can constitute a risk during pregnancy, like rubella, or other type of toxins like alcohol, cocaine, pesticides, air pollution, fetal growth restrictions, and autoimmune disease that can really affect the fetus during their development, and it can develop autism in the early stage of the pregnancy. Most scientists agree that genes are one of the risk factors that can make a fetus develop autism spectrum disorder. Also, children that have siblings with autism spectrum or children that are born from older parents are in a great risk of developing this type of disorder. But actually there is no exact evidence where is the critical period for the development of the autism spectrum disorder. It can be before, during, or immediately after birth. Autism affects information processing on the brain and how the nerve cells and the synapses organize and connect with each other. And this process is not really well developed because this is a spectrum, which means each person has or can have autism in totally different ways and having different structures and different connections on the brain. Autism spectrum disorder affects all type of races, all type of ethnical groups or social economical groups or communities, but is 4 times more common among boys than girls. Each person with autism has a different type and very distinct set of strengths and challenges. People with autism may communicate, interact, behave, and learn in totally different ways from each other, and of course from other people. The learning, thinking, and the problem-solving skills or abilities can range from gifted to severely challenged. Some people need a lot of the help in their daily life routines, and others can reach almost independent level. These signs are signs that are typical and common not just in adults with autism spectrum disorder, but also with the children too. And they are not point to objects that are calling their attention, not look to a certain object when other person is pointing them, have a problem relating to others or have no interest in other people whatsoever, avoid eye contact and wanted to constantly be alone, have trouble understanding other people's feelings, and have also trouble understanding their own feelings, and even talking about their own feelings is something that is strange for them. Usually they don't like to be cuddled, or they only want to be cuddled when they need, which is not very often. being eventually really interested in other people but to not really know how to relate to them, how to talk to them, how to play or how to reach them, repeat or echo words or phrases, have trouble expressing their needs, usually when they have to use the normal words to have a meaning for that kind of feelings, not be able to play pretend, repeat actions over and over again, have really trouble to adapt to new routines, particularly when they have to change for some reason, have unusual reactions to the way things smell, taste, look, feel or sound, or even lose skills that they used to have. And have a very specific interest or focus. For instance, have a specific interest in numbers, in facts, in details, and they stick to this as a comfort moment for them. And of course, the repetition of words, behaves and phrases that they can hear and they tend to repeat constantly. And being much more sensitive than usual people are to a sensory input, like for instance to lights, to sounds, to noise, to temperatures, even to clothing. Diagnose autism spectrum disorder, it can be really challenged because there are no medical tests to diagnose this type of disorder or disease. So doctors have to look at the child behavior and child development and more or less understand if this is in a normal range. Even consider that each child develops in a different way. The normal age to start to diagnose in this type of disorder is around 2 years old, but there are lots of children that much older they receive a proper diagnosis about autism spectrum disorder. And the main thing of autism is that the treatment has to start as soon as possible. Early treatment is very important because it can help reduce individual difficulties while help learn new skills and how to cope with certain problems in order to straighten their behavior and their response to that issues. So working close to a doctor or to a healthcare provider, it is very important because it helps finding the right treatment for the right person or for the right child. Some medication can be used to treat some symptoms that are a little bit more common with the autism spectrum disorder, and some of them are irritability, aggression, the repetitive behavior, hyperactivity, attention problems, anxiety or depression. With therapy, this type of patients, they can eventually learn to improve, learn life skills that allows to live a little bit more independently or that allows to reach a higher level of independency, reduce challenging behaviors, increase or build new skills, and learn social communication and language skills. Being autistic, it doesn't mean that this patient has an illness or a disease. It means that this brain works in a different way than the common people. And it's something that it is born with or that appears in a very young age. And if a person is autistic, this person will be autistic for the rest of her life. Autism is not a medical condition with treatments and cure. And some people with autism need support to help them with certain things, and others doesn't need this type of help. If you want to learn more about autism spectrum disorder, there are some associations around the world in different countries that can help you, giving you more information about special care, about trials, and about special research in this area. And so that's all for today, guys. I hope you like it. I hope you subscribe to the channel. Give a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video. Bye!